So today we're going to be talking about COVID testing in schools and what that means for our students and families during the 2021-2022 school year. So today we're going to be covering why it's important to test, what are our testing options, what does that look like, consents, and then asking or allowing families to ask questions or try to answer some areas that they have concerns in. So different reasons that we're going to be testing for COVID in schools is to help monitor the COVID-19 levels. It helps reduce absenteeism and lost time in instruction and allows students and staff to stay in schools. It also allows us to get tests performed quickly and get those results back faster. They're quick and easy to perform, and they're free and open to any students or staff that are interested during the school year. And it also provides an alternative for families. Currently, the state vendor that DPH and DESE has chosen is called CIC Health. Their staff are trained healthcare professionals that will help come into the schools to help perform tests and make sure that the lab results are sent to the courier who will analyze them at the lab. It's optional for students and staff. It is not required. And folks can consent now or consent later. There's open rolling consenting during the school year. It's also free and provided through a federal grant from the Biden administration that was given to Massachusetts, and it follows the state guidance from the Mass Department of Public Health and DESE. So there are three testing options that schools have available to them. The first one is symptomatic, so for those students who may present with symptoms at school, as well as staff. Close contact, so students and staff who are identified to have close contact of a person who's tested positive for COVID in the schools. And then test and stay, so those students who may be close contacts who are able to stay in school through a testing program. So currently, Granby Public Schools is choosing to do the test and stay and the routine COVID safety checks for our current testing. Potentially in the future, we may be doing symptomatic testing, but right now we are just doing test and stay and the routine COVID safety checks. For primary symptoms for individuals who may have COVID-19-like symptoms in school, those symptoms that are most concerning are the ones that are bolded on the screen on the left side. So fever of 100 degrees or higher, chills or feeling shaky chills, having difficulty breathing or shortness of breath, a new loss of taste or smell, or muscle and body aches. On the other side, the combination symptoms are these symptoms that may be in combination with other things such as a cough, sore throat, nausea and vomiting, a headache, fatigue, and nasal congestion or a runny nose. Again, these symptoms would be considered to be concerning if they're in combination with other symptoms if students and staff present this in the school setting. So for the state definition from DESE and DPH for schools for a close contact is defined as someone who's within 6 feet of a COVID positive individual indoors for at least 15 minutes over a 24-hour period. They are considered to be infectious about 48 hours prior to showing symptoms or having a COVID positive test, whichever one comes first. And then they are considered to be contagious, that COVID positive individual, until they are isolated from others. So under current testing for Granby schools for close contacts, there are some exemptions. So the first, for individuals who would not have to quarantine or get tested, is those who are fully vaccinated and asymptomatic, meaning they have been vaccinated against COVID-19, they've received both doses, for Pfizer or Moderna, or the one for Johnson & Johnson, and they're presenting with no symptoms. There are also those who are on the school bus who've been fully masked with the windows open. This is a federal mandate at this time that regardless if schools have made the decision to wear masks or not, that students must wear them on any form of public transportation, including riding buses and vans to school, back and forth. Also, those who may be in a classroom that were masked and at least spaced within 3 feet of each other, they are also considered exempt. And then those who are close contacts who have had COVID-19 in the last 90 days. So again, the close contact needs to be 15 minutes within a 24-hour period. Those brief contacts within less than a minute, like transitioning through hallways or in other places, does not count. For our test and stay option for those who are identified as close contacts and are not exempt on the previous slide for quarantining and testing, they can get tested using the antigen test, the Binax Now, which takes 15 minutes to get a result. First thing in the morning, they can get swabbed here at the school for 7 days, and they can remain in school as long as they continue to have no symptoms. They wear their mask at all times except for eating and drinking, and at least maintain that 3 feet or more of distance from their peers and staff. And then they have a negative antigen test, the Binax Now, each time. And then obviously continuing to monitor for symptoms for 14 days from the initial date of contact. So if they are identified as a close contact on a Monday, they would need to monitor themselves through the next 2 Mondays to make sure that they are not having any symptoms. So at any point during that 14-day period when they're monitoring for symptoms that they display, they are asymptomatic, turns to having symptoms, then they need to follow our symptomatic protocol. So we would be asking them to get a PCR, an antigen test, and then quarantining until those test results are received, and then going from there. Based on the positive or negative test results, we'll determine whether individuals can remain in school or not. And again, as part of the test and stay program, other than coming to school, it's highly, strongly recommended that individuals quarantine just to maintain the safety of all. For individuals who may decline to do in-school testing, they can get a COVID test outside of school, but would need to remain quarantined for 7 days, getting tested on day 5 or later after their initial exposure. And then as long as they receive a negative test result and continue to monitor symptoms actively for 14 days remaining asymptomatic, then they can come back to school on day 8. If they end up displaying symptoms during the 14-day period, we're going to ask them again to get tested, especially if it's after day 8 or between day 8 and 14, to quarantine and get retested just to make sure that they have not developed symptoms of COVID. For those individuals who decline both in-school and out-of-school COVID testing, they need to quarantine for 10 days. They do not need to get a COVID test if this is what they decide not to do, but they have to actively monitor for symptoms, and then can return to school on day 11 as long as they have been asymptomatic and monitor themselves through day 14 of this. Again, if they have displayed symptoms, we do highly encourage that they get tested and follow our protocols for symptomatic, or if they end up testing positive, our COVID positive requirements. So for our routine COVID safety checks, this is involving combining multiple samples from a group of individuals. It can be students or staff or a combination of both, with a maximum of 10 samples from 10 different individuals at one time. We are opting through this current testing model to do the saliva testing option, where individuals will spit into a tube. The lab will take their sample, combine them with up to 9 other samples, including that individual's, and then keep a little piece of it in case that group tests positive. And they're going to be checking the group for COVID using a PCR test. This would be done routinely at random on Mondays, first thing in the morning from both schools, including students and staff, to identify if there's any active COVID levels in the school buildings. If the group COVID test is negative, everyone can remain in school and continue doing their normal routine things at home and at school. If the pool group comes back positive, they will take that second sample that was taken from each one individually, and they will check them one by one to see if anyone tests positive. That group, as long as they're asymptomatic, can remain in school, and they are to wear masks until their test results come in. Those who are symptomatic in the pool group will follow our symptomatic protocol and remain home and follow those other guidance at that time. In the future, if we decide to do symptomatic testing, which is a potential, we highly encourage families not to send sick children to school. This is for testing of students that develop symptoms during the school day. It is not used for families to send sick children to school to get tested. We highly encourage families, if this is the case, a student wakes up in the morning with symptoms, that they contact their healthcare provider to determine if they need to have a COVID test or not. And this is for vaccinated and unvaccinated individuals. So those individuals who are unvaccinated and are identified as close contacts from the COVID symptoms list that we showed earlier would need to quarantine and get a COVID test, either a PCR or an antigen test, or receive an alternative diagnosis before returning to school. For those who are vaccinated and who are not identified as close contacts, they would again fall under exempt as long as they have no symptoms. Would quarantine if they have the primary symptoms listed on the left side corner of the slide that we showed you earlier that were in bold: the fever, the chills, the shaky chills, if they have a loss of taste or smell, or any of those other symptoms. For those with the combination symptoms like sore throat, cough, and all those other things, they contact their healthcare provider, and the provider can determine if they need a COVID test or not. So those students with potential COVID-19 symptoms, we would be again sending them out if we are not having the ability to test them here at school. They would need to have a negative PCR test to return or have an alternative diagnosis. They need to be fever-free for 24 hours without the use of fever-reducing medications such as Tylenol or Motrin, and have an improvement in symptoms. If they are identified as a close contact and are not exempt from testing, then they would need to again have a resolving in symptoms and have a negative PCR, and then they could participate in the test and stay protocols. For those individuals who test positive for COVID, they need to quarantine for 10 days, either from the day they started having symptoms or the day they had a COVID positive test, whichever one comes first, and can return on day 11 as long as they've had no fever for 24 hours without the use of fever-reducing medicines such as Tylenol or Motrin, and have an improvement in symptoms. If their health condition appears beyond this and requires more intervention, they may need to have clearance from their local Board of Health or the State Contact Tracing Collaborative, whichever group that they are working with for clearance. There is no COVID test required to return back to school. This is not recommended by the state at this time. So on the consent forms that have been sent home through the Connect Ed and are also available on the district's health services website, these are a state form developed by the state that have been given to all school districts that require a yes or no answer. These consents are optional for families, and we understand that it can be challenging to determine which test options are best for you. Families can choose 1, 2, or all 3 options depending on what is available. Just as a reminder, at this time, Granby is only doing test and stay and the routine COVID safety checks. If you want your student to participate in one versus the other, you can either email or send in a written note of which one you would like them to participate in with their consent. And again, if families decide they want to either add on or take off a testing model, they can do that at any time. They may email me or call me in my office, and I will provide my contact information to you in a little bit. Just a note about absences. According to the Department of Ed, students who are marked absent for illness are marked absent, but they can work towards attendance recovery. This form can be found on the district's website main page. We also encourage families that each day that they're absent that they complete the online attendance form, particularly for Granby Junior Senior High School, and call East Meadow. At this time, they are in the process of also creating an online form, but we highly encourage families to make sure that they're calling their students out so the school is aware of what is occurring with their child. This time we're going to play a video from the Department of Ed to share with families that helps put all of this information together.
DESE guidance mandates that at the start of the school year through October 1st, all students, educators, staff, and visitors, regardless of vaccination status, must wear masks while indoors and while riding buses. The purpose of this policy is to encourage higher vaccination rates among students and staff, and to implement a uniform policy for all schools to begin the year. This measure will allow school to fully reopen safely. After October 1st, the policy allows for middle and high schools with vaccination rates of at least 80% to lift this mandate. Unvaccinated students and staff would still be required to wear masks. DESE will revisit the mandate as warranted by public health data. Exceptions are students who cannot wear masks due to medical conditions or behavioral needs, any person eating indoors, and when outdoors, masks are optional. Districts using approved diagnostic tests or the statewide testing program can implement a new test and stay protocol. Under test and stay, asymptomatic close contacts of individuals with confirmed COVID-19 can remain in school, and they do not have to quarantine if they receive an individual rapid antigen test each school day and test negative, are asymptomatic, wear masks in school at all times other than when eating or drinking. When eating and drinking, they should maintain 3 feet of distance from other individuals to the extent feasible. The following close contacts are exempt from testing and quarantine response protocol if they remain at least 3 feet apart and masked while in classrooms, wear masks and keep the window open on buses, if they had COVID-19 within the past 90 days, or are fully vaccinated and asymptomatic. The duration of the test and stay program is 7 days from the date of exposure. If the 7 days include weekends or holidays, individuals should quarantine during those days. If they remain asymptomatic and are tested immediately upon returning to school and test negative, they can stay in school. Individuals should conduct active monitoring for symptoms throughout day 14 and self-isolate at home if symptoms develop. Self-isolation for COVID-19 positive cases is a minimum of 10 days after symptom onset or after a positive test. They can return to school after 10 days once they have been without a fever for 24 hours without taking fever-reducing medications, and they experienced an improvement in all other symptoms. DESE and DPH continue to strongly recommend that all faculty, staff, and eligible students receive the COVID-19 vaccine. There are more than 900 local vaccination sites available across the state, and most accept walk-in appointments, including CVS and Walgreens pharmacies, pediatric primary care offices, and community health centers. As a reminder, the COVID vaccine is free for all, and no ID or insurance is needed to obtain the vaccine. Visit www.mass.gov/COVID vaccine for more information. Districts and schools are encouraged to maintain or establish diagnostic and pooled testing for students and staff. Districts are strongly encouraged to sign up for the statewide COVID-19 testing program. Diagnostic testing, such as the Binax Now rapid antigen test, is an important tool as we head into cold and flu season, and for use in testing asymptomatic close contacts. DESE and DPH will continue to offer these services at no cost to districts. These no-cost services include optional support for districts that want additional staff to conduct testing on-site and/or help with testing logistics and communication. Additional information: DESE and DPH urge all schools, and in particular those with vaccination rates below the Massachusetts state average, to host an on-site vaccination clinic during summer orientation events or when classes begin. A DPH-approved mobile vaccination provider, including clinic staff and vaccination administrators, will be provided free of charge. Interested schools can submit their request via an online form located on the mass.gov website. By working together, we can make our school a safe place to learn and work.
So if anyone has any questions about the testing, COVID testing in schools, you can reach me, Nancy Jenks, the nurse leader, at njenks, NJENKS, at granbyschools.ma.net, or Stephen Sullivan, our superintendent, at ssullivan, SSULLIVAN, at granbyschools.ma.net. Any questions or comments or concerns, please feel free to reach out to us. And thank you for attending our COVID-19 testing in schools. We will also be hosting a COVID vaccine clinic shortly during the month of September. We encourage anyone who's interested, resident, student, family, to come and join us. Have a great day.